understandably, when we face these big moments in our lives, our thoughts often go to the big questions. Will I live? How long will I live for? Who's going to take care of me? And it can feel really, really overwhelming. For most people, there's a lot to take in. There's a new language, a whole new set of concepts, and the thoughts of sort of further down the line take a little bit of time for people to get their heads around after they're dealing with the initial shock of a diagnosis. Sometimes these harder realities do start to sink in, though. Will I be able to work? Will I need to cut my hours back? How will I pay bills? Will I need to talk to my employer? These are not the initial thoughts on anyone's mind, who's diagnosed with a blood cancer or any form of serious illness, but they will occur to everybody within quite a short space of time, and they can really add into the anxiety. There is lots of financial help and assistance out there, and the good news is, starting from the very, very basic, everybody with any form of cancer should know that while they're on treatment for that cancer, they are eligible to be exempt from prescriptions. So if you ask your nurse specialist or your doctor for a prescription exemption form, you can send that off and you'll get a card, and that will mean you're exempt not only for the drugs you need for the disease that we're treating you for, but say, for example, you went to the GP with a bit of a fungal toe, you're also exempt from those sorts of prescriptions as well. So that is absolutely open to absolutely everyone. And if you're not already getting that, you should certainly look into that. Now, there is a raft of different sets of benefits that people are eligible for. Some of them means tested, some of them universal. A lot of them will be age or circumstance dependent. So universal credit, for example, statutory sick pay, tax credits, working tax credits, council tax reductions, and even personal independence payments, which I know there's a lot in the news about at the moment. I won't go into too much detail about all of those because there's lots of expertise out there of people who understand the system very well and are really able to talk individuals through their personal eligibility for those. So most hospitals and most departments will have a social worker, but there's also benefits advisors normally through the hospital or through charities such as Macmillan's. There'll be a welfare, rights advisors, citizens advice are great. You can go in there and they'll help you fill out any forms that might be confusing. Or you could go to the DWP, the Department of Work and Pensions, who are set up in the Job Centre, and again, very helpful people who understand the system well and will help you make sure that you're in receipt of everything you're entitled to. And that can really take a weight off people's shoulders, especially if there is a period which is really tricky, which sometimes there is in CML, especially at the beginning, where you might need some time off work and some additional support. But also look at charity websites, so Cancer Research, Macmillan, Leukemia Care, for example. They've got whole sections devoted to helping people navigate through that system. There is access to grants as well. Some sources of grants, unfortunately, aren't there anymore. But I'd recommend looking at an organisation called Turn to Us, who can help you to sort of see what you're eligible for. Sometimes, everybody knows this, whether you've got a cancer or not, that sometimes you're just getting by and then the boiler breaks down and it costs more than you think. And then on the same day, the washing machine starts leaking. And sometimes, we do need that additional little bit of money, or you might need some adjustments around your house, or your bed might be too high to get into, if you're really suffering with side effects. In CML, this is not the experience for everybody, but for the few individuals who might need some additional support, I'd really recommend looking at an organisation like that. Also pop into, if you've got a Maggie's near you, Maggie Cancer Care near you, or in Wales, there's 10 of us, which is a fantastic organisation supporting patients living with a cancer diagnosis. But I'd always say, look at your individual finances and reach out to your facilities providers. People like energy providers. So I know, for example, E.ON and EDF have both got sort of hardship financial funds, and I'm sure other energy providers also have something similar. Talk to them, tell them about your circumstances. If you've got a car on leasehold, get in touch with the dealership and let them know that you've had a change in circumstances at the moment, and see whether they can change the terms or the conditions for you, at least temporarily. Talk to the council about council tax. Tell people that you are in a period of difficulty, and you might find that there's much more flexibility in the system than you might have imagined. Don't let it get on top of you. Don't let the bills stack up. Let people know and seek advice early from professionals. The other people I'd say are really, really good and known for it are Macmillan Cancer Support, because their charity really focused on helping cancer patients. They've got a brilliant benefits calculator on that. I mean, they will say it's only a guide, but it's a pretty good resource. They've got a helpline if you just prefer to speak to someone, lots of information online. And they can help you sort of navigate claiming benefits with housing costs, or even making changes to your mortgage or claiming on insurance policies. You know, a lot of us can get quite far in life without having to sort of navigate those sorts of things. And sometimes when you have these big jolts on the road, these big sort of life-changing events, you know, it can be really hard to keep your brain focused on the intricacies of this, and it's really good to have that helping hand to support you through that. They've got lots of information on there. Lots of it is in easy read format as well, because a lot of the language is technical, and it helps sometimes for all of us to have it spelt out really nicely and clearly. So lots and lots of help out there. And it is about, letting people know and reaching out and, letting that support come into your life and support you. I've just one little flag to fly at the end here. If you're under 40, there's a great charity called the Willow Foundation. And if it's all getting too much and you just like a bit of a treat, have a look on their website, and they can really support people going through a diagnosis or living with a chronic illness or a cancer, to have a bit of a treat, to have a special day out. They do all sorts of things, sort of visiting football stadiums, going for a spa, or they might just send you a lovely, great big basket of things, because all this is about getting life straight and living with new realities in the best possible way that you can. And sometimes all of us could do with a bit of a treat to help us through that and lift our spirits. So lots of help out there. Get in touch with your nurse specialist, Macmillan, any of these charities, and they're brilliant and supportive.